and even some allergen-friendly donut bowls if you're like me and can't do gluten and dairy and stuff. So please feel free to grab that as we go. We will not interrupt us if you get up and have a donut. With that being said, today we are going to go through, we're going to talk about establishing street outreach meetings. That has been a long time coming. There used to be regular street outreach meetings here in Pinellas County. We want to make sure that we get those fired back up. But first and foremost, we want to make sure that we have these written standards figured out, agreed upon, and finalized as best as we can. I don't think that we're going to finalize this document today. Suzanne and I were talking about that over the weekend. We would be amazed and wildly impressed if we got there today. But as close as we can make it is the goal. So we're going to talk about the meetings. We're going to work on these standards. We are also going to work on street outreach mapping. There is a map, maybe some of you have seen before, that has everybody's coverage on it. That map is kind of old, and I think it would be really good if we could get that updated, and if we could get updated hours, services, location coverage, and whatnot. So if you came prepared with that, fantastic. If not, feel free to write that down right now while we're talking. Go ahead and write down your services, your hours, locations, contact information, all that stuff as best you can. If we don't. There are a few that we still need updated. So, that being said, let's go ahead and jump in with really super quick introductions. I'm just thinking name and organization that you are with. And Daisy, do you want us to get started and we'll go around this way?
Sure. Good morning, everybody. Thank you for being here. My name is Daisy Perea, and I'm the CEO of the Homeless Leadership Alliance.
Hi, everybody. Victoria Kelly, Homeless Leadership Alliance.
I'm Megan Robinson. I'm with the Homeless Leadership Alliance.
Suzanne Boylan with the Homeless Leadership Alliance.
Kathleen Beckman, Chair of the CoC.
Pastor Bill Lasasso, Lighthouse Church.
Roger Suarez, Pinellas County Human Services. DeQuisia Jones, 201 Tampa Bay Cares.
Jane Kumar, VA.
Helen Martin, City of St. Petersburg.
Good morning, John Paul Coleman, Metropolitan Ministries Brigade.
Morning, Sarah Hernandez, Pinellas Brigade.
Pat McBride, Steve Largo, Home Salvage.
Officer Phil Pony, CPPD Homeless Outreach.
Officer Don Ziegler, CPPD Outreach Path Team.
Brad Olsky, City of Largo.
April Wyatt, City of St. Pete Street Outreach. Shanice Reed, City of St. Petersburg.
Excellent. Wonderful. Thank you all for joining us. Oh, Dominique, just in time. Name an organization.
I've got some more. Hi,
Oh,
everyone.
excellent.
Dominique Randall, Pinellas County Human Services. Hi, sorry, I tried to
Make it easier.
Oh, you're good, you're good.
We have a few more chairs we can add on the inside as well if we need to.
I got to come around with
All right, so we have just a couple of new folks who have just arrived. Would you mind doing your name and organization for everybody, please?
Sure. Ramona Schaefer, Program Services Supervisor with the Pinellas County Sheriff's Office.
Thank you very much, Ms. Ramona. You heard it.
Hey, I'm Jennifer Stress, the Executive Director for Alpha House Pinellas County.
Thank you very much for joining us. Excellent. Thank you all very much for being here. I was hoping that Officer Copeland from Pinellas Park was going to be here today. Maybe he will join us a little bit later as well. But with all of that in mind, let's talk about establishing street outreach meetings. So outside of the next meeting that it will probably take us to actually finish these standards, because I do think that finishing the standards and establishing these regular street outreach meetings are two separate things. So outside of the meeting to finalize these standards, because again, I don't think that we will actually do that today, we need to talk about how often we would like to meet as a group to discuss street outreach and what we would like those meetings to look like. That is to ensure that we are coordinating, that people have the resources that they need. And, you know, to really make sure that street outreach looks and feels the same no matter what part of Pinellas County you're in. Because that's really what we want to do here, right? Do we want these meetings to occur bi-weekly, so every other week, or do we want to meet monthly? Is there a proposal for everybody here? And also, we are leaning towards a virtual meeting for this. I know that everybody has different schedules. This is the entire county, so this would be, unless other people would prefer in-person meetings, these would be virtual meetings regularly.
Would anybody be opposed if we did one virtual and one in person, just so that we have that in-person communication?
Any thoughts?
I'm just gonna talk because people are quiet. I want people to fight with me, okay? So my thought is, we meet every other week till these are finalized, and then go to monthly. I think we need to also be considered mid-county. We have Largo here, that came pretty far, and I don't see Clearwater. You all came pretty far as well, so, and then actually you guys in this work down here, but those are my ideas. Just so I can get people talking, fighting.
Location would be something else that we can talk about too, if it's something more mid-county that is a little bit closer to everybody, we can do that as well. Yes.
I'd also like to state that Mondays are extremely busy for outreach. My phone's off the hook, I have 20 voicemail I can't get to. So Monday may not be the best, because Tuesdays are intake now, so if I'm gonna get people in, I calculate that morning to get that together, so another day of the week would probably be more effective. Not Tuesday morning, because the intake, but maybe.
So not Monday or Tuesday.
Yeah, just because
So we may be looking at a possible Wednesday or Thursday. I know we have a couple meetings on Fridays with the funding providers, sometimes the board of directors, so maybe possibly Wednesdays or Thursdays.
I think the teams are off on Friday too, right? There's 4, 7, 35.
Yeah, we're all running.
How do we feel about
Clearwater is off on Friday.
How do we feel about Wednesdays? Wednesdays are generally a pretty decent day as far as meeting availability. Wednesdays, okay. So Wednesdays, we will do Wednesdays, and do we like Dominique's suggestion of bi-weekly until these standards are finished? Hopefully that's only 1 or 2 more meetings, but I might be being optimistic. And then monthly from there.
She wants somebody to fight it, so.
All right. Dominique,
Well, the other town says he's not available on Wednesday morning, Oh, yeah. so if we want Cindy outreach, we probably
Yeah.
wanna do Thursday.
okay.
Cindy got
Our afternoon's better.
What?
Whatever happens, we'll figure out a way to work around it. Wednesdays or Thursdays, we'll figure it out.
Okay, listen, that's okay, I can see the discomfort. So with that in mind, would the room be opposed to Thursdays? There's just like one Thursday morning, or 2 Thursday mornings that the HLA can't do, but there are 2 free Thursday mornings that we can do. I do know, Helen, is that a problem for you? With,
I'm one person in St. Pete is well represented, so
Okay.
Wednesday afternoon, Wednesday morning, Thursday, doesn't matter.
Okay.
I think Wednesday afternoon.
Actually, Wednesday, not
Wednesday.
At 1 o'clock it was changed to, starting the 28th.
So.
And then we
Thursday,
do obviously
Tuesday.
have like the monthly prioritization list meetings that are usually in the afternoon, but that is once a month, each subpopulation.
And
So
then on
the
Wednesdays.
Thursdays.
So those are every other week, right?
So the family prioritization list meetings at 1 o'clock from 1 to 2 virtually on the first Thursday of the month. I might be getting this opposite, but the individual ones are the third Thursdays.
So we could
And
do,
then veteran is every single Friday morning.
so we could do the opposite Thursdays there if we wanted to.
If Wednesdays work best for the group, then we will work around it. If
Okay.
Wednesday's a better day for everybody, we will work around it.
All right, let's do show of hands, and then would somebody, oh, are they not coming
Can we
here?
look at the actual date on the count, like the September month day that we're looking at?
I'm glad you're here.
We're talking about 18, 19.
We've got some extra chairs, we got like 4 chairs. Kathy, there's a space over there.
Right
Right next to
here,
me,
Kathy.
Kathy, come on.
Or just like,
Or, no, you can pull up just
So you're looking at like the 11th and 12th, if we're doing 2 weeks, or are we doing 18, 19?
Let's pull up the calendar, everybody
I showered
should see.
Where's that?
Got it? I know what you're saying.
11 and 12, maybe that's.
Okay, yeah. You guys
Oh, I can't see it.
Alright. Alright, so there is a calendar up on all the screens. So everybody knows these screens are all going to be the same every time. So, if we did Wednesdays, we would be looking at the second or fourth Wednesdays. Because you do the first and third, right?
Yeah.
So we would be looking at the second or third Wednesdays, so the 11th and 25th, for instance. Or if we did Thursdays, we could look at the first Thursday, or the second Thursday, or in the afternoons, on the 3rd or 4th. So, do we have for everybody who just got here, for everybody who just got here, we're talking about regularly establishing street outreach meetings for the county. We're talking about virtual for one, in-person for another, and kind of going back and forth like that. And we are talking about Wednesdays versus Thursdays for these meetings. Helen?
And my only ask while we're doing this, the standards is that they not be virtual. It's very hard to get work done in that way virtually.
Yes, ma'am. Yes, ma'am. All right, so show of hands for Wednesday. All right.
I can do Wednesdays, but it's morning.
1, 2, 3, 4, 5, 6. Show of hands for Thursdays.
As long as it's in the morning.
1, 2, 3, 4, 5, 6, 7. Okay, 7. Thank you. All right. So we'll do Thursdays. Any objections? All right.
And morning time is best, right?
At least for us, as soon as afternoon hits.
Yeah, and I have meal exercise I have to go to every day, so.
So Thursday is starting the 5th of September? Did we say?
Yeah, seems like it.
Okay.
That would be the next week. Or
Well, we need to find out, because we want to do mid-county, right?
Yeah, we can figure out location. But for now, okay, so we will work on every other week. We'll work on every other week, Thursday mornings, starting September 5th for these meetings. We will meet in person until these standards are finished, and then we will go from there. So excellent. Thank you all very much for working through that with me. I really appreciate it. Now we can move on back to why we are actually here, which is to talk about the street outreach that is being done.
All right, hello everyone. So now we'll be kind of diving into the system mapping. I believe that you all should have received an email or in the standards or separate attachment, there should have been an actual document that showed the coverage assignments. So we're going to dive into any possible changes. I will open up and share my screen with a handy dandy new fresh map so I can start drawing. But before I do that, I would like to share the actual coverage assignment that I currently have right now. So I'm going to pull that up and share my screen. Bear with me. Is it in the packet?
No. Okay. The coverage assignments.
yeah.
It's okay if it's not, because I'm gonna share it on the screen. There are 4 of these,
One for every table.
okay.
Or no, sorry, there are like 10 of those.
Go ahead and pass
Yeah, there are some. Sorry, there are a couple of these little spreadsheets here with, for the tables.
Alright. So it would probably be best if we can either do this as a large setting, just to ensure that everything we see on the screen and on those sheets that Ms. Beckman is sharing right now is accurate. A lot of the responses or the little narratives on the right side of that worksheet where it says additional info, that was information that was supplied during last year's NOFO, when we had reached out and inquired about information for these selective SO projects. So if everyone wants to just take a second to look. Also, if you don't see your street outreach project on this actual like Excel spreadsheet, go ahead and take a handy pen and fill it in, and then we'll kind of regroup in like 2 minutes. But if everyone sees that theirs is on there, just raise your hand and then we'll go from there.
So, do you see, is that treasure island where they share that in the street outreach, is that on there?
I believe so. Yeah, let's pull.
Oh yeah, correct.
Okay, so what's gonna be this week?
I'm gonna pull it up here as well.
Just like a little share.
Be careful.
Yeah, mine is.
Oh, I think Victoria just did it. No, okay. Is that you?
It's me.
Okay, thank you. So then, I have that little map image. Should I help you look? I think we still have just a few more people glancing, so just give it another 2 seconds. So I was gonna write this in, but since you're sharing it for
If there's anything that anybody wants me to scroll to here on the computer as well, I can.
I'm gonna type in, this is a live document, so anyone that doesn't have this. And if everyone is done looking it over, we can just start with the ones that we see right now. If you are here, you are that specific SO project, and you are here, and there are changes that need to be made. We can start off with City of Largo. City of Largo, if you take a look and see at the additional info segment to review if that appears to be accurate as far as the hours of operations and the locations, resources, anything in here that is not indicated.
So Todd works Monday through Friday, 8 to 4. We have an officer that works Monday through Thursday from 1 p.m. to 11 p.m. And then the other officer works Tuesday through Friday, 06 to 4 p.m.
Okay, so
So Monday through Friday is basically covered, but on Mondays and Fridays, there's one shift that's not covered by an outreach officer.
okay, so Todd, your hours again one more time, I'm sorry. Or you can repeat.
8 to 4,
8 to 4.
Monday through Friday. Depends on if he goes to the gym or not.
Okay. Alright, so outside, so from 4 to onward, right, during the day, Monday through Friday?
So-
no coverage.
Yeah, no, we do. So Monday through Thursday, Melandra works from 1 p.m. to 11 p.m.
And how do you spell that name?
Malandro.
Alright, so I have Todd Monday through Thursday, 8 to 4, Monday through Friday. Monday through Thursday, 1 p.m. to 11 p.m., Melandro.
Yep, and then Tuesday through Friday is Stanford from 06 to 4 p.m.
6 p.m. to?
6 a.m., sorry. 6 a.m. to 4 p.m.
And who is that SO working with?
Stanford is his last name.
Out of these 3, are there any additional SO staff on the team? Okay, Todd, you have access to HMIS, right? Melandro and Stanford, no access, correct?
They're officers, so no access. And then we have a support personnel, Jody White, who is kind of the backup HMIS and housing, but she's not out on the street at all.
So her primary responsibilities, if we can give
Mostly
it.
administrative, in terms of like running reports and stuff through HMIS, but that's it.
Okay. Is she still acting as a backup for Todd when, okay. All right, in that additional info segment outside of the hours of operations, does everything else appear to be accurate? And also, is there anything specific that's missing?
No, everything looks right about right.
I think another positive aspect of all that is that the officers are understanding what I do, the officers that are assigned to this outreach aspects. So we're getting a lot of things funneled through all the officers now, kind of becoming more collaborative, they're understanding what we're trying to do. So I think 24/7, there's somebody always communicating with someone for someone to get back to as quickly as possible. I think it's probably happening in all cities, but I'm just noticing that change as I come on about a year now. There's better understanding of what we're trying to do.
So how much time would you say, Todd, that you are identifying those that are on the streets versus responding back to, like being dispatched by phone calls? Approximately.
Probably outreach itself, I mean, I do a little bit of outreach myself independently. So I have dispatch connected on the radio, so I have that support as much as the officers do. So I'm probably out, I'd say 50-50, you know, a lot of calls. But then I'm usually going out to outreach to meet where they are to get that, you know, next step in the outreach, you know, to get to know them, so they know who I am, you know, looking at my, you know, just putting out the board. So it's probably 50-50 right now.
Okay, 50-50.
Calls, yeah.
Okay, so 50-50 between calls and being on the streets.
Yeah, and talking to other professionals and trying to connect.
Okay. All right, I think that's good, for City of Largo. And just to confirm, unsheltered individuals and families, correct? All right, did I miss anything as far as the questions that need to be asked? Again, it's a work group, so anything that I missed that we want to make sure we capture during this meeting?
I have a question, it might be as people go around and fill in the blanks for their street outreach, but is there, a reason why there's not coverage, on the weekends? Is it paying for weekend work, why is it Monday through Friday?
Most of your staffs in your locations aren't manned on weekends with somebody we can reach. Okay, plus if somebody needs shelter immediately, Safe Harbor is always available, and all of our patrol officers countywide can take anybody to Safe Harbor immediately if they need, if individuals need shelter.
Got it,
Okay,
makes sense. Thanks.
you're welcome.
We just added, PCSO's information in from Lieutenant H. We sent that today. As well, so they are doing, Monday as needed, Tuesday through Friday, 5 AM to 5:30 PM. In public places countywide, focusing on unincorporated areas and cities without municipal law enforcement. They are providing immediate placement in Safe Harbor, placement on the Pinellas Hope referral list, information on various detox programs, workforce development, and they're offering socks, water, care packs, HLA resource guides, Pinellas County Human Services resource guides, and the public camping flyer.
Was there any specific information provided regarding the subpopulation that they're outreaching? Okay.
Adults, individuals.
I know that
The name of the outreach social worker and their shifts, or no?
Nunez, Tuesday through Friday, and Morgan Monday through Thursday.
Nunez works 5 AM to 3:30. And John Morgan works 7 AM to 5:30.
And 7 AM to 5:30?
Yes.
Thank you.
So a similar question that I asked Todd, would you say that it's 50-50 between dispatch and being on the actual streets, or?
Well, Mondays are kind of iffy because I have Nunez working Tuesday through Friday, and then I have John Morgan working Monday through Thursday. So I don't, if I had it just off the top of my head, maybe 60-40, but Mondays are just maybe the opposite, where they're doing more administrative duties on that Monday because we only have John.
And should the SO staff encounter a family with minor children, are we saying at this point that the assessment for a family that is literally homeless on the street, they will not be conducting or administering the family shelter assessment for that family to get onto the list?
I thought they were getting trained to do the assessment, but we were unclear as to what to do with a family because we don't place families at Safe Harbor. So we were asking for next steps. What happens in the other outreach teams when you encounter a family? But we're willing to do the assessment to get them into the system, but we didn't know exactly what to do after that.
Yes, and that would be actually talked about with great detail within that SPL training that I wanted to set up with them. So I just want to make sure that the willingness is there, right? Like, are they willing
To do the assessment,
Yeah.
of course.
Okay.
Of course, to do the assessment, but I don't know anything past, I can't guarantee transportation, I can't guarantee placement. That's the ambiguous part that I just need a little bit more clarity before I, but doing the assessment, absolutely, and getting them into the HYS, that's not a problem.
Okay.
I had a question, and how they're paired and partnered, made me think of it with, because I was talking to John last week. I know with Largo, you guys can be together or separate, and then with, that might be relevant as far as the teams, how you all operate with the
They're
sheriff.
separate,
Okay.
they're usually Nunez, I'm sorry. So Jesus is paired with a deputy, and then John is paired with the deputy to ensure more coverage, as opposed to taking them both as a team, because they can just do more coverage if they have two separate teams. So that's how that's working out.
So they are being dispatched together though, right? Like John and an officer.
John and an officer, and Nunez and an officer.
Right. So I didn't know if, since I needed to notate that.
I'm so sorry.
It's okay, it's okay. So the sheriff's office does an officer and the outreach worker together.
Okay.
That's something we talked about years ago, and then you guys can go independently or with an officer, or you always.
Ours is pretty much all independent.
Yeah,
Once in a while,
we have to call, we have a camp and find, loads, and then I'm going with an officer, because we're going into, an area that's, the visibility is limited, support is needed. But if I already have a client, I'm using my 10 warrants, because I wanna get a little more information, and wanna get to know them, then I can do that independently, and have the radio with the same amount of the car, and go check in on me, so that's the difference, I'm not going to, where it's by myself, I'm not going to.
Right, and that's a directive by the sheriff, who did not want the social workers to go out independently at that time, and until he changes his mind, that's the model that we're sticking.
Right, but that's what I'm saying, is to notate that on the chart, I think is a relevant thing to do, because the groups all do it a little bit differently. And some have an officer and some don't. That's right.
So transportation for individuals to the shelter, should an individual that's unsheltered say, I am willing, or an individual that SO staff with Sheriff's Department had dispatched to, they're able to transport that individual to said shelter, correct?
Yes, to save money.
To Safe Harbor specifically? Okay.
Because I don't know of any other shelter that would accept someone. Yeah, there's only. Safe Harbors are all yeah, so that's why it's nothing.
Okay.
It's just, that's the only shelter.
Let's see. I wanted to get to DFL really quick, Pat. Michelle Hanson, you're here.
Yes.
All right, so geographic area for DFL Pat SOT.
So we really are, City of St. Pete, I mean, it's really where the need is, it's not like one specific place on one specific day. We have someone that is out and around PSTA on the regular, we have somebody out at Gulfport and Treasure Islands, and then the City of St. Pete and anywhere else in Clearwater where there's a need. If someone has called us and said, hey, I've got someone out here that needs a ride, I know April works with you, and we'll send our outreach, we have a van, and they'll go pick them up and get someone. So we're pretty flexible across the county.
All right, so how many SO staff specifically are considered to be DFL's path SO?
There is no DFL path.
No?
No, they're DFL's solo.
Yeah, we are.
They're by themselves, it's only their employees. The
Okay.
PATH team is independent.
Right, they're separate
Where
from
the
us.
PATH team is with St. Petersburg Police Department, not the Sheriff's Office, not SLPD.
Yeah, but PATH is a funding source, so it's a completely different acronym.
Right.
Oh, okay.
Sorry.
So yes.
There we go.
So,
That changes the confusion.
yes, not over speaking for you.
So how many staff are with this version of PATH for DFL? 4.
Did you say 4, Michelle?
Okay, and their names? Just first name.
So April just wanted, they report to me, you can just reference me.
Okay.
From moving forward.
Okay.
It'd be easier because then, but she just wanted me to list my name as.
Oh, just, okay. All right, and let's talk about the hours of operations, similarly how we did with Largo, is there?
It's regular business hours.
So like a 9 to 5 or an 8 to 5?
I mean, if they're in the middle of something, they're gonna see it through, but, you know what I mean, it's for 8 to 5 would be our standard business hours.
Okay. And all 4 of them at the same time?
Different spots.
Okay, so they're getting, they're going out to different areas, so are they kind of, independently going out to those separate areas, or is it 2 and 2 going
They're
out?
independent, and it's really depending on where the need is and who we're working with.
I mean, I think we have to put that in parameters that, we have assigned hours, Well, I could be there till 5:30,
Well, that's
5:32.
right, as I'm saying, we're gonna see it through.
There's always a flow to it, or I'm gonna be home early in the morning at 6 and call them back, because the need is high, so I come in and work with them at 7 or 8. So the hours definitely flex, these are not solid for us, actually.
Okay. All right, would you say as far as the, getting dispatched and responding to, calls versus being on the streets, would you say what percentage is that?
I would say probably 50/50, just depends, I mean, if we're getting a call from somebody or it's hard to say, I mean, most of it comes through me anyway, so I would say probably 50/50.
Do you have the ability to transport? Oh, right, good, sorry. And what kind of resources are being, provided?
Connections to shelters, food, really any and all resources depending on the need of the client. Or a person. So food, anything, really, transportation, if they need ride to the shelter, if they need connection to a mental health provider, over to the health department, you know, whatever they need. And our main goal is sure we can support where they're at.
Okay. And is there also a phone line? No phone line, just you, okay.
Do you my number?
Nope, I got that.
I know.
It's okay. I'm sure you wanna give it out.
No. So
Well,
yeah.
yeah.
It's out.
May I ask a clarifying question?
Yes.
You want us to give your phone number out for street outreach, your cell phone number? Okay. Appreciate it,
Yep.
And, unsheltered population, just to confirm, individuals and families. All right, and I know that I provided the training for SPL for some of your staff.
We have some new staff, so we were just talking about this last week, we're gonna need some additional team members that. Right now, I think I only have one person who can do yes for that, it's actually trained.
Okay. 1 out of 4?
One out, yes.
1 out of 4, so there's been some like turnover or
It's just, yeah, we've had new case managers, we've fired additional.
Okay, so, EFL Pinellas Park, is that the same thing as, okay, completely separate?
It doesn't exist.
No, that does not exist. Oh, that's good. When did that end?
May.
2021.
June 1st.
Okay, City of St. Pete, street outreach. I already know the answer to this confirmation, so I don't need to, but just for the purposes of everyone, you are identifying and assessing individuals and families.
May I just ask,
Oh,
I
yes.
have one more question. Is that for inclusive of the new person that will be for St. Pete?
Say that again?
Is that for inclusive of that?
Yeah, yes.
Okay, thank you, I'm sorry.
That's okay.
Well, if we're asking a little clarification. So you've got 4 individuals and you're the point person. And you cover you cover county-wide, pretty flexible around the county, you said, including Clearwater, St. Pete, Gulfport, Treasure Island. I'm just wondering.
We have one person dedicated to Gulfport Treasure Island.
Okay.
Does that help clarify?
A little bit, but I'm like, I know, because I'm from Clearwater, so I know Kathy Ham's got
Sure.
handled. So how do you coordinate things with?
I don't, I'm never here for any of that.
Okay, so, but I'm wondering how our homeless that are at the refuge or St. Vincent Paul Soup Kitchen even know about you,
Well, I know, I've talked to Sean and them quite often, So they know about us.
Okay.
So I've been out there, I mean, they know the way, and they call me.
Okay.
Kathleen, they're also at PSTA specifically in St. Pete now, but they did just get social action funding for St. Petersburg in general. So the PSTA is different than, so that's when they're in St. Pete, they're at PSTA specific and not surrounding, site specific.
Okay.
However, they will now be throughout St. Petersburg, so it'll be a little different. But we do coordinate with Michelle, quite often.
A lot, daily, really. Especially for our families.
Okay, good.
For St. Pete.
Okay, for St. Pete, yeah.
Okay, so the two SO staff were previously specifically targeting the PSTA SCP, but now due to the SAF funding that's come about, they are going around and you are collaborating with April. Okay.
But not with Candace.
I mean, I know she's there, and I don't know, obviously why I was there, but if the need be, I have to remember, it's not like.
Especially for families.
Yes, whatever.
Can we just change the lingo a little bit into that SO for street outreach? Because I kept thinking you're talking sheriff's office. So just say the words, no acronyms. Everybody's got 10 different lingos going on in the room, so just complete words. Thank you.
Thank you.
Very confusing.
And what is your math again? I don't know what the acronym is.
I put on the spot. Because I hear SO, I think sex offender, so I'm like, so I mean, I'm just, for frame of reference.
So I'm gonna flag this for everybody. This, document right here, it says street outreach about once, maybe twice, and everything else says SO. We did that because honestly, it eliminated like 2 full pages of text. Okay, I'm just throwing it out there. If that's something y'all wanna see changed, we can change it. It's just gonna make the document a little longer.
Okay. All right, so, City of St. Petersburg street outreach. All right, April, did you see anything in here that requires changes, updates, needs to be scratched off, needs to be added in?
I know we were doing some different times with weekends or things, is that it? Or?
As of right now, everything here looks good. Sometimes we're on weekends, but it's kind of here and there. So, but if those calls get diverted from the police dispatch to us, to the PAP team, we take care of it as is, so.
I am not right now on the weekends. It's just more of our PAP team call. I'm Monday through Friday.
So when PAP does identify an individual or specifically a family on the weekends, that family specifically has to wait until Monday, so April could.
If PAP identified them on the weekend?
Yeah.
I don't know that they have, but I mean, all PAP has my cell phone number, so if they identified them on the weekend, I think they'd be making some phone calls.
We would reach out.
Yeah.
We would definitely reach out. If we're working a weekend and we identify a family. Also, first step for families per everybody else's guidelines was their first step is calling 211.
That's our patrol guys, information on the weekends as well as to 211 it, make sure that they're aware that they can get up those resources soon. So just make a phone call.
So we have not encountered a family on the weekend yet with our PAP team.
Sometimes you encounter them on cold night shelter nights, families that can't go into adult shelter.
Yes. Unfortunately, we would partner with and work out and then we gotta go to directions depending on. We collaborate very well with our providers.
And then, what kind of resources, I just want specifics,
Everything that was written in here, so hygiene items, food kits, winter kits, food packs, depending on the need, also help, linking them with prevention services depending on families, individuals. And we ride separate, we ride together, daily. I normally would ride with an officer 1 or 2 times out the week, and then I go off by myself as well. There's never any time I'm at an encampment ever by myself, it's always, with our past meeting.
Did y'all hear that? We don't go.
Well, yeah.
We learn.
I'm my supervisor.
Right.
So do you have actual funds for those bus passes, or are they already allocated or like allotted to April for her to?
We have funds.
We have fun.
We have,
We also,
power change funds that, we can use for anything that has to do with the person that's under.
How many times would you say that's utilized, when we're leveraging and utilizing diversion?
we don't use power change for diversion. We access our, so when we say bus passes, we mean like PSTA bus passes, you're talking
Not regular.
travelers aid?
Yeah.
So we utilize Daystar for
Okay.
travelers aid. Or HLA, I know that as well, for diversion.
Can I ask a question about, you said you do some, diversion, or prevention? How do they connect, how does a family that may be on the verge connect with you for diversion?
Email, phone call, I mean, any way they can get to us, a lot of times it's through emailing somebody in the city, or even emailing me. They get, also our contact information, we have a hotline as well, that they can call
It
into.
goes to you as street
It
outreach?
goes to us or anyone on our PATH team, we'll make sure they get it, to me or Helen or Shanice as well. And then, like I said, we connect with what our resources we have out there, and sure, it's pretty much it. 3 girls in the car.
But we actually do a lot of diversion.
Yes.
Yeah, I mean, we get calls all day, emails all day, it comes to the mayor's office, if it comes to any elected official, it all comes to us. So we're not just, homelessness, we are social services for the city.
And even our PATH team as well,
Yes.
when they get the calls on the line, they're doing diversion before it might even get to the social work side. They know the resources and how to access
Do you
and
have
connect.
data on that? Because that'd be phenomenal to know how much prevention and diversion you've done, annually or something.
If we use our power of change funds, yes, but most of the time so power of change, if I have a family who just lost their housing because their house caught fire, then I am diverting them in that way. It could be that I'm putting them in a hotel quickly and then wrapping their family around them, giving them clothes, foods, those things, so we do that. So if we use our power of change funds, then yes, like we started out with $10,000 at the end of last fiscal year, and now we're at 2, because we're not holding on to our residents' money out there that they're graciously donating. But, we are very good at connecting resources. Like we also have $250,000 that DFL oversees for prevention as well. So we have money out in the area. We're really good about connecting those people to those resources. And it's not like a cold call. It's like an email to Michelle, hey, can you talk to this person? Everything we do is a warm handoff. So I don't have that data. I mean, it could be easily pulled because we have to pay them back, right? It's cost reimbursement. But just numbers wise, it just depends on if there's a fire. Sometimes PD may come into contact with someone, just math.
Yeah.
And I think HOA can give some numbers as well
Yes.
from the diversion funds that we use it.
We're connecting with them. I think what St. Pete does really, we connect really well with our resources, with our partners. I've literally, just about everybody in this room, I got numbers and I can give a call. I'm like, hey, it's me, y'all. I need something else. So that's, I think, is the good thing about at least for St. Pete.
So it's 9:50, and I just want to respect the agenda, but I also want to get a roll call on how everyone is feeling. Do we want to take a quick break for the agenda, 9:50, and then dive into the written standards, or do we want to pass the break or delay it? Do we want to have those SOTs that are here continue to, finish off this coverage assignments matrix? How are we feeling right now? Do we want to dive into that table and eat some things for a couple of minutes? Or do we, what do
Can
we
we
do?
at least finish this
Can we
out?
finish?
Yes. Alright. Okay, as long as everyone's okay with that. Okay, so Clearwater Police Department. Yeah, Clearwater Police Department and City of Clearwater Street outreach. Individuals and families, Kathy, I already know that, but, just for everyone here. The geographic area I have here is City of Clearwater jurisdiction and those in unincorporated North County areas when assistance is sought via the city outreach. Is that accurate? Okay. So when we're talking about unincorporated North County areas, can we be specific what that means?
Dunedin, Palm Harbor, Oldsmar, Carson Springs. Because if they're calling this, they're coming. I'm trying to hit them off before they get into the city and get comfortable.
So Dunedin, Oldsmar, Palm Harbor,
Carson Springs.
Carson Springs. Alright, so that leaves Safety Harbor kind of out of it, right?
Oh, no, Safety Harbor, they call me from Safety Harbor.
They do too. Those areas are primarily dispatch, would you say, because you're focusing on the Clearwater jurisdiction as far as
Right.
the literal on the street outreach?
That would be dispatched.
Okay.
If they come from those areas. Yeah, we work with the sheriff's office.
Alright, so you are canvassing, the city jurisdiction. It sounds like there's also a police social service special. Are you the police social service? Is that your title? Okay. You work independently in a company of police officer, of PO to interact with those in need. PSSS visit meal sites and service agency sites to offer assistance. You canvass those parks, those parking lots on the street. You're using a city-provided vehicle to canvass jurisdiction and seek engagement, has ability to flex hours to attend to keep engagement after service agencies are closed, work night shifts and weekends. Is that accurate?
But you got on here Monday through Friday. I work Monday through Thursday, 8 to 6. And then we flex. Like I might come in and work at 10 o'clock at night till 5 in the morning. Just depends.
So when all of those unincorporated North County areas that we just talked about, Dunedin, Oldsmar, Palm Harbor, Carpet Springs, Safety Harbor, when those are being dispatched to you, is the phone number that you're using to speak with me, is that the number that they would be reaching out to you on?
Yeah, myself.
Okay.
And then we'll be linking up with the sheriff's office, case managers, when possible, moving forward now that they're up and running, but we still work together for things that's needed.
What would you say the ratio is with dispatching and being on the actual streets?
Well, it depends because I have a vehicle. Because I'm mobile, so I would say 40, 60, I'm on the street, and then 40, Mondays is the worst day to get out. It's a lot of evening, more evening stuff.
So 40, what would you say your ratio is?
It's like 40, 60, I'm out 60% of the time, if not more.
All right, anything that was missed in there?
No, I mean, I'm the only current one. I mean, we are going to be possibly seeking another person, and then we'll kind of split up the city. But we have 9 downtown vacuum officers that work with me, and then we have all of patrol with every officer at the city level that does outreach. So if I'm not available, they all know what to do. I'm the only one that does HMIS, of course. But, you know, weekends, the phone's monitored for emails and phone calls.
Well, I wanna mention, I'm the only one that does HMIS as well.
All right, so after those times, Monday through Thursday, 8 AM to 6 PM, it's those officers that are kind of doing those outreach activities.
24/7.
24/7. So it fills in that gap, would you say?
You know, primarily the 9 officers with the downtown fire team, but now, I mean, it's every officer. And then, of course, everyone will be trained for October.
And what kind of resources are you providing, and what kind of warm handoffs does that look like on a day-to-day?
What is it?
I'm sorry, resources,
Radio.
resources and warm handoffs, what does that look like on a day-to-day for you?
For what resources? Well, the city provides funds to all the different resources, so, I mean, diversion, you know, it has to be approved by me, but it goes through, a different entity that we provide the funds to. For diversion, same thing. If it's verifiable, a city resident that needs hotel stay, but it has to be, those funds have to be within the city.
That's kind of hard if verifiable as city resident. I mean, they're homeless.
But it's not, it's still our funds. I mean, it's city funds.
So I mean, it's,
Yeah.
So what needs to be verifiable, the residency of Clearwater for the diversion funds?
No, diversion funds, I can use that for anything. So they roll in out of California, I can put them right back on a plane and send them right back out immediately.
Okay,
The hotel stay.
hotel stay.
Yeah, they're not, I mean, they can't come from Indiana, plop down in Clearwater and say, oh, I'm homeless now in Clearwater.
Right, we have to same, like, the same thing, we have to have an ID to verify
Right.
within the jurisdiction.
Not paying for that, and we're not encouraging them to come down here homeless, so we're not encouraging it all, so yeah. I'll do diversion back, but I'm not paying to overwhelm the system that's already overwhelmed.
There's also a system of vetting, so if somebody's going back to diversion, you can't send somebody back that's homeless in another state from here. So we have to vet that they have somebody to go back to.
Yeah.
And then somebody's gonna take, take responsibility for them on the other end, support somehow, and then we can get, I think we're all the same in that type of
Right,
process.
they have to have someone on the other end of the line that they're gonna go back to. I mean, we've done 90 in less than a year so far,
Okay.
with only 2 or 3 that didn't follow through and come to the decision and get on that plane.
Understood, so with respect to unsheltered Clearwater residents, that is that's a requirement for those hotel fund requests. And how far up are those hotel requests going? If you pay for an individual or family, is it both?
It can be.
Okay, how long are those hotel funds for?
They can't be for any longer than 3 months. Like I have a girl that has cancer that's been doing treatment, she's right at her 3 months. But we won't do a family that long. Most of them need to be working, get jobs, find out what their plan is that they're gonna do this. We're not gonna keep them that long.
All right, does anyone have any questions or any other clarifying questions?
about, so April and Kathy, you guys mentioned that you are the only ones who do HMIS enter in. I'm wondering if that's because of the cost of the license for HMIS, or is it because that's your expertise, you know what to enter because you're working directly with people?
Because all of my coworkers are officers.
Right.
So they can't have access.
Police officers.
According to
We're not allowed to
HMIS
have
now,
access to
they're not allowed to
HMIS,
have
it's a protected
access to
system.
HMIS because it's protected.
Yes,
Right.
Okay.
The protection is for if somebody has a warrant and we're looking him up in HMIS and know where he's getting services, they feel that maybe the officers
Got
will
it.
use it to
Got
search, in a way that's not
Yeah.
authorized. So HMIS is a protected system, no sworn officers allowed access to HMIS.
Okay. Yeah, so they don't have that, like, if we're talking to them though, and they're, and it's like, no, you already been to Pinellas 3 times. Why? And the officers can talk to them, you've already been. What's not working? So that the officers can talk to them to find out, how can we work with them? And make it more individualized, as a plan. But as far as anything else on there, like, unless it's a missing person, nothing's disclosed. And then we can just say, well, we can contact an agency, they are active, but we don't say, oh, no, they're going to the soup kitchen to eat on Thursdays. You know, we'll just say that they are active, that we will reach out to that entity and give them the information for the family member or whatever, or just verify that they've been seen recently, so.
Kathleen, for the city of St. Pete, I have access to HMIS, I do not input into HMIS, it's not that I have a license or anything, it's just makes sense for one person. But Shanice and I also we do outreach as well, but April is the only one that's okay.
I just know those licenses can be expensive, and I think they're a hurdle for people and capacity for you to really be face-to-face and somebody else can take it. Okay, thank you.
But you really don't want to work in isolation. I used to manage in Texas, and you don't want isolation of one person only in the HMIS, because you're the only person who can get data off that system. So my boss, Earl, on the housing side, and Jody, who helps me populate my monthly reports for HLA. It's kind of oversight, support you to make sure we're getting that data in, it's accurate, it's in real time. You're not post-dating it, it's in real time. So it's good to have that oversight.
Makes sense.
So it's 10 o'clock now, we did skip the break. Next on the agenda at 10 o'clock technically was us starting to dive into the outreach written standards. We kind of have a little bit more on these coverage assignments, but what we can do is we can come back to this, or we can continue and start diving into those standards. What will we want to prioritize for this meeting? Do we want to continue, or do we want to finish this later on or during our next session?
Honestly, I think that we need to look at the written standards. If there's anything that's missing and you want to jot it down in the form, you can just pass it to Suzanne and we'll just update it.
Okay.
If there's anything that you want to chat with us after, that we could, but I would like to kind of start looking at the standards.
So, I'm good with doing whatever way, but I would say if we don't know what people are doing and we can't get to the bottom of written standards, that's our problem now, is that everybody's doing things differently. We're already going to continue meetings for the written standards, right? So if we finish this and start the written standards, we've got another meeting scheduled for the 5th, that will continue on with the written standards. That was my thought process, like,
I just wasn't sure.
if there are other street outreach people in the room that might not be here for the written standards part, at least we will have gotten through this, and so we'll have an idea of how to, if we don't clean this up, we can't do the written standards, because everybody's doing things differently.
That's fair.
That's just my thought.
Right, yeah,
But I'm like, Dominique,
I wasn't sure.
argue with me. Don't fight, I won't fight anybody, but argue with me. I mean, they don't have to debate.
You have a So then do we want to take just a really quick break to eat something, or do we want to keep going?
Alright, yeah, let's do 5, let's meet back at, let's do 6 since it is 10:04. Let's meet back at 10:10. Restrooms are out the way you came in, that little walkway out to the parking lot, restrooms are on the right-hand side.
Okay, so
Everybody, it's time. Welcome back. All right. So let's go ahead, let's dive back into this spreadsheet. Let's get this finished up so that we know exactly what folks are doing, where coverage is, so that we can get to these standards. And then get those finalized so that we can really get to the heart of what it is that we need to do, which will not be today, don't worry.
thank you. All right, so the next in this matrix is Metro Ministries Brigade. Just to confirm again, just for the purposes of the group, the population that you all are identifying and assessing is individuals and families, correct?
Individuals. I'm doing the VIs, but that's for families, but my team is only focused on individuals.
Okay.
So yes for individuals and families? For outreach?
The brigade is focused traditionally individuals only. We're not trained to work with families, we don't have the resources for families, so we will refer out to other organizations that work with families, just to make sure that we're not re-traumatizing folks and asking questions that we don't have answers to, or being asked questions that we don't have answers to.
Okay, so the,
I do it, yeah.
so the identification and the encountering of families with minor children, what does that look like then? Is it just dispatch, solely dispatch, or are you going out, since you are focusing on those VIS cadets?
As of right now, we've just been getting them through phone calls. We've been getting our hotline, quite a few families now that are starting to reach out, and those get transferred to me directly.
And are you doing them over the phone, or are you going out to the family?
Both. Initially, we'll do it over the phone, and then I'll go out and meet with them.
Okay.
So you'll reach out to them via phone, and then you'll kind of coordinate like an in-person meetup.
Yeah, if we're doing outreach that day, then we'll just go meet with them that day, but if like we're working out of Safe Harbor or I'm in the office or whatever the situation is, then we'll initially do it over the phone.
Usually you have to have 3 touches with someone before you're gonna do the yes to that, so.
For families, it's
family.
different.
But, you know, usually I'm gonna assess what's going on, because I'm doing a lot of talking. Do you have family? Do you have anybody else? Let's look at your whole case system here. You might have something here that you're not, I can help with advocacy. So I'm doing that also. So that's usually when I meet with everybody, it's usually 3 times while I'm doing BS with that.
Yeah, for individuals, but for families, it's supposed to be your first contact and then.
Yeah, but I've got a lot of families that are looking for resources, and they actually have resources already lined up.
Yes.
And they do have housing.
Yeah, so that's our first step, is to always divert every time.
Yeah.
We're hitting divert, which I know that Kathy and everybody else, every time we're doing diversion. But if not, if they're saying, hey, no, we don't have anybody,
Right.
we all are doing the VIs that hopefully within those 24 hours.
A lot of folks figure out the system, you know, how to, it'll be cross-pollination. I'll be dealing all of a sudden, I'll look on HMIS and the SAM's already open. So they're just looking for any store that's open that can support them. So you wanna make sure you're not duplicating service. You wanna make sure that these things will be done when somebody else is on it, or I'm gonna say, I'm sorry, you have to go back to this one. You're already open with the city of Clearwater, obviously you own that jurisdiction. So you have to do all these things, you have to make sure you're not, you know, doing it after that twice. You know, there's a lot of little things you have to watch. That's what you were asking, how do you know somebody's a resident? You can ask the right questions and get it out. There's people that can play you and they know how to wiggle around, they learn around folks, but most of the time you can kind of get them, you do a little research and you get into HMIS and start picking at things, but wait a second, you've been through the system in every program, but you're acting like you've never been in the program. What's up, just stuff like that, you know. Just wanna make sure you're not duplicating things all over.
Right. So I know that MetroLink, you all have a calendar of where you are physically located, where your staff is physically located in that, on that respective day, in that respective time. Would you consider that to be, at this point, in reach? And then there are other days that you were actually like conducting out, like big O, right? Like big O or big SO activities like on the streets?
Yeah.
Okay.
We'll be changing our schedule, not our schedule necessarily, but we'll be focused on more outreach now. Our team grew by an additional 4 individuals, so we'll be able to split that time of being at the sites and providing those services, and also at the same time be out doing outreach and engaging with folks, so, yeah. So we'll have that outreach as a whole, I would say 100% at that point.
And how many staff currently are there?
I have 5 team members, and then myself.
Suzanne, may I ask a clarifying question?
Yeah.
When you find families, I heard you say you do the VIX for that, and then what?
Oh, we connect them to different resources, like depending on their zip code. We partner with our program, the neighborhood program a lot. They start, depending where they're at, we'll refer and reach out and see what other, if it's like, if we're in Clearwater, I reach out to Kathy all the time. So,
okay.
thank you. Not all the time, but, yeah, when we reach out to each other.
We'll
So
reach
you
out.
reach out to the other street outreach that's in that area, okay?
Okay, so it sounds like more like collaboration, warm handoffs, but then as far as the actual resources being directly provided for those families or individuals, what are some direct resources that are being provided? I guess I would say like, I don't like to use this word goods, but like bus passes,
Okay,
food,
yeah.
I just
Things like
sent you
that.
an email with all that too, but we can talk about it. So,
Oh,
yeah.
okay.
So we can do, obviously, like HMIS entry, the VXPDATs, we also help assist with applying for food stamps, we help with ID vouchers, birth certificates, travel assistance as well. Most of us are now source certified, there's a few still, but we're source certified as well. Social security cards.
Identification.
Yeah, we do hygiene kits when we have those,
HMIS IDs,
HMIS IDs.
we can do those anywhere.
Okay, so I know originally when Metro Min had, started, taken off, you all were, how do I say this? Trying to canvass areas that there were no street outreach activities, right, to fill in those gaps. It sounds to me like there are some gaps that have been filled from the existing street outreach providers, which we are all so fortunate, and grateful for. So what does that look like at this point in time, or is that being worked on with the updated calendar?
It is, we still go all the way up to Tarpon Springs, so we're doing our street outreach down at Gulfport, and if we encounter somebody, we'll work with Elijah or Andrew, whomever is out there, and we partner up, right? We don't want to duplicate services, but we want to make sure that they're also being taken care of. We're not going to turn anyone away, but yeah.
Okay. All right, does anyone have any questions for Metro Min or anything that I missed that we need to get clarification on?
And if you do want to get the calendar sent to you monthly, let me know, we can add you to the email distribution list. I think most of you are already on it.
Are we on that? I'm sorry, I don't think we are, or I am.
I don't think so. I know I sent it to Andrew and I just talked to Elijah a lot and stuff like that, but I don't think formally it's not sent out, but I think.
Yeah, okay.
All right, so next on this matrix is Treasure Island Fire and Rescue, with the geographic regional area being Treasure Island. Does that still exist, or has that changed at this point?
I think it's directions, right?
We have Elijah out here at Treasure Island.
Which we talked about, because he's considered to be staff for PFL TAP, like your version TAP, not, yeah. Okay. So that's what's being called when you're enrolling a project in HMIS. There is no specific project enrollment for Treasure Island Fire and Rescue. Merge, we'll say merge.
Are they sharing a street outreach person with, Gulfport and Treasure Island, right?
Yes.
I think that's you guys, okay. All right, and the program, all right, and you were working with Dan McDonald? Was he part of it? Okay. You worked with the, okay.
Alright, so PCSO, I think we talked about this one already.
Haley's recommendation.
Alright, so Bay Pines Veteran Outreach Hotline. Now, are we considering this to be general outreach, or are we considering this to be specialized outreach?
Specialized.
Specialized?
Yeah. For veterans, right? Yeah, that was special.
You're special too.
Any of the SO programs that we've talked about in this matrix above, we can all like confirm and agree that they are all considered to be general outreach, not specialized. How do we feel about Metro Min being considered general? I mean, do we want to consider that to be general? I don't like big labels, but I feel like we need to, just in the sense of a matrix.
What would you consider specialized?
I think that's something
Would
that
that
we.
be veterans or,
Huh?
like veterans or what do you?
In the outreach standards draft, I think I had put like a definition of what that really means and entails. I think we really need to talk about that, to agree upon what specialized outreach means, right? So I'm not the one just creating and making up that definition.
What do you mean by specialized?
That's what I'm
Is it
saying.
like domestic violence survivors, is it veterans, what are we saying?
That's what I'm saying, like the definition needs to be.
What is the definition currently?
Well, we all work with domestic violence as a
I think
patient,
so.
so that's not specific.
I say in general.
I
I'd say
think
like-
that
I think it's
they're
like a little
general,
SO
I think Foley would
I
be
think
specialized,
Foley,
and
yeah.
I think,
Vets would
that
be
veterans
a-
would be specialized.
I think like a targeted population,
Yes.
right?
Yes, targeted.
So it makes more sense to
Or
define a
integrated
specialized outreach based off of a subpopulation, like if a subpopulation is specifically being focused on in that project, in that program, we're gonna consider that to be specialized and targeted then, specialized subpopulations, all right.
Can I ask just a question about the veteran services that are, they have a lot of resources? Easily you could have veterans that are experiencing domestic violence or veterans that have families, right? And so how do you categorize that?
Under veterans?
Just under veterans, and then you have subcategories, whether they're veterans with domestic
Lots of
violence.
them here too, but I can answer too. So veteran services have domestic violence, services and other services within SSVF or
Okay.
GASH.
Okay.
Well, and also veterans can access any service,
Right.
non-veterans just can't access veterans
Right.
services.
Right.
So typically they'll go in anywhere, and then if they're veteran, you want to pipe them through the veterans so that
So yeah, they
they
get
get
the
the
focus
attention
and
they
they
need.
get those funds they're spending.
Yes.
When you run into veterans that have the designation for leaving the military, it's up in the air, or they're trying to figure out what their benefits are through that avenue, so sometimes I get them because they haven't connected completely, or they have a hard time following through with the process, so you have to kind of support them. So it's kind of a referral agent for even veterans.
Their eligibility is limited to some of the
Right.
They don't
discharge
quite know that.
criteria, right? I think that's changing too, though.
It's changing a
Yeah.
lot.
Yeah, that's
Yeah,
right.
our eligibility has expanded a lot and continues to expand again. And I don't think people do know that, so it's good that they do go to the hospital and see what they're eligible for, or like, you used to call me all the time, or call me and I can look up eligibility.
Right. We refer them to them specifically to find out what they're eligible for.
Yeah.
Because they may have been in, but are they eligible for services?
Right,
They need
or
to
they think because I didn't, I don't have an honorable discharge, I'm not eligible, when in fact they're eligible for homeless services, but not medical care.
Right, so that's what we tell them, they need to go down there and find out what they're eligible for, and then if it's the homeless services, they can come back, that kind of thing. So we can, but it's best that they talk to eligibility to find out specifically what they need. And then if it's just shelter placement while they're doing that, those are things.
So the unsheltered population that I'm entering in here is incomplete. I'm going to put veterans, but I wanna get confirmation on when it's through the actual outreach hotline, which I believe is Fabian, right?
Our outreach hotline's rotated by a different person every day.
Okay.
It's
So
often Fabian.
to take advantage of veteran outreach hotline, so is he completing the eligibility and or squares or whatever, since you guys have homes, is he doing that upon
We check
calendar on the
eligibility.
hotline?
Yes.
And then is it exclusively the hotline, or is the team also going out?
So I wouldn't say street outreach big X. We have 3 dedicated outreach workers, and then we have 2 that can assist in outreach and have different roles but can cross over. So we have an outreach schedule, but right as of now, we're going to sites. Every Thursday, we're at, just for example, every Thursday, we're at Daystar, every Monday, we're at the North Soup Kitchen at St. Vincent, Tuesdays, Pinellas Hope. So we have but we are interested in partnering with street outreach and or at least networking. Like I know you have my contact. I met Eric, I think before, do you guys still have an Eric or was he gone? Oh, okay. I kept hearing people say Ty. So,
It is Tom.
He's hot, he's the new Eric.
Eric, look, you can call me whatever you want.
But Eric's been gone for almost a year, so.
I haven't, like I know Eric. So that's what if people who are out, and like I said, we will go out too, but if they're out, they can call me direct and I can send someone out.
Okay.
What we have found, like, we have a mobile outreach, and they were going to Williams Park, and there were tons of homeless, but not veterans. So we kind of felt like for us to continue to go out and there's not the veterans, it might be better to network, and we will send someone out when you're with someone, you know?
Okay, so 3 dedicated outreach workers are currently going to 3 sites within a week, like in the same week, right? So there's 3 sites that they're going to.
We actually do Pinellas Hope, Daystar, both the St. Vincent Soup Kitchen, so 4. And then our mobile unit goes up to Shepherd Center in Tarpon Springs.
And then the other outreach workers, how many are there?
So
For
we
the other
have,
areas?
we have 3.
Oh, in total?
Yeah, in total,
Okay.
yeah.
These are the same staff members who are also rotating and answering the hotline?
Correct. And then we have, to make it more complicated, our mobile unit outreach worker, so that's one of the 4, but he wears many hats, right? So he's the one that goes up to Tarpon Springs. He also lands on the days he's not out in the mobile unit, our homeless walk-in clinic. So anyone who comes in the hospital that's homeless and has a primary care doctor, they see that social worker with the primary care. But if they come in and they're not registered yet, they come into the walk-in clinic, which is another outreach. So we have, and that's Monday through Friday. On the weekends and after hours, our ER social workers work on tons of homeless issues. We often on the weekends will lean on Safe Harbor and then in the week pull them out right into a VA program.
So the hours of operations for the hotline, is that 24/7?
So the hotline's actually a national number and it's manned 24/7. And then it's routed, so the local med center. So if it's routed to us, we're only answering calls 8 to 4:30. Locally, it's only being answered. But like throughout the evenings and weekends, if someone calls and is homeless, they can give, they have like a general idea of local resources that they're handing out.
Okay, so when it's routed to the local number, that would be Monday through Friday, 8 AM to what?
4:30.
So none of these outreach workers through Big Pines have access to HMIS, right?
No.
Jane does. Okay, so let's take it through like a little mini short flow, what it looks like when they do come through. They are proven to be, or they are shown to be actually homeless, right? So then it gets routed over to you or us, the vet nav email, so that we can provide them that access point? Gotcha, okay. So they're not actually doing the assessments, they're sending it to the vet nav so we can do them. So we're actually capturing all of those that are being outreached by this outreach, okay?
have a question about that. Does the vet nav go out to them? Or
Yes,
is it
so
just-
Sidonia goes to Bay Pines.
Okay. So when they connect with them, Sidonia comes out and does their assessment?
Alright, I don't believe I missed anything, but if anyone has any questions for Blossom or Jane.
I just have one question. I know that there was something that was sent out regarding emergency, housing services for hotel motel. Is that something that is gonna have a different impact or workflow coming October 1?
I have not heard, and it's been asked, like, and I think actually we're supposed to just ask at a national meeting, you know, is there gonna be any more flexibility with emergency hotel? And it was a very general answer, you know, we're looking at it, but nothing has been a firm guidance that we will expand as we did in COVID with emergency hotel.
Okay.
Any other questions for Blossom or the veteran specialized outreach? Alright, bowling, do we have anyone from bowling here?
No.
Do we have anyone from family resources?
No.
Is anyone here that is not on this matrix? Raise your hand.
I talked to Pinellas Park for you.
Huh?
I talked to Pinellas Park for you.
Okay.
So if you wanna write down their information.
I don't even think he will.
Oh, they have.
So you did, I think that's one of your blank areas on the very beginning, where you kind of had DFL/Pinellas. I think you meant to say Pinellas Park, is what I thought. At least that's my guess.
Okay,
So-
so what do they call,
So
what is it called?
Copeland is still their homeless outreach officer. He works Monday through Thursday, 8 to 6. He, like we said earlier, I think that's when they went through, they canceled their contract with DFL in May. Since that time, they've partnered with PCSO's mental health unit. So they have a crisis response specialist that rides with Copeland now. So he's kind of doing double duty, both as their mental health officer and as their homeless outreach officer. So probably about half of what he used to do in terms of outreach. And then they don't have access to HMIS at all. He doesn't do the ISPDATs, and we refers all that to 211. Thought that was all the questions that I had.
So we're losing all that data into HMIS from whatever touches.
Yeah, I mean, I think he's still doing like referrals to Pinellas Hope, so if he does,
He is.
if he does a referral to Pinellas Hope, he'll do that there. So I think that's,
What you're missing is
But no
the
family.
handoff from the outreach piece to the referral to the shelter.
To the shelter.
There was one, I mean, I'm really glad that you actually just brought that up. Out of all of the street outreach projects and programs that we just went over, everyone that's here, I think we need to get, like an itemization of who is able to refer to Pinellas Hope, Safe Harbor obviously is walk-in. What about HEP and Salvation Army? Who refers, which SO projects are referring? Huh?
I said, and St. Vincent de Paul.
And St. Vincent de Paul is my shelter.
Yeah. Well, it just depends where you contract.
Right,
We're
shelters,
contractors,
who
we
have,
pay
whether they have the
space
space available.
To my understanding, it's not like that, but did that change?
No,
So what you're probably thinking about is like how Pinellas Hope does referral every week. So each shelter doesn't do that. So Pinellas Hope is the only one that every Tuesday, they have a list and most of them can call the different street outreach or the sheriff department and get on the list for Tuesday. But the rest of the individual shelters is just about calling or emailing and seeing if they have open availability, and any street outreach can access that. And then Safe Harbor is 24/7.
You might be mentioning, you might be trying to ask about, like, there's like Largo, we use as an example, they fund a project at HEB, so they have additional benefits for them. Pinellas Hope as well is funding related, so St. Pete has more than Pinellas Park, same thing with Turning Point, which there's capacity always at Turning Point, but you all fund more beds there. Is that what you're trying to do at?
Yeah, so for the non-contract or the non-specifically funded beds though, from what I understood, at least the last information that I was provided was that you would still need to get referred by a street outreach person.
Everyone.
For even for St. Vincent Paul's Night Shelter, but it sounds like that's no longer the case.
No, I don't know about St. Vincent because we don't fund that, so that's always an option if I don't have anything up here, but we try not to send Clearwater residents down to St. Pete, because they're already overwhelmed enough. They don't need that, so we try to utilize what's available up
I
here
think
to
HEP
us
does
first.
does ask that they have a referral
HEP,
from
right.
a street outreach worker. But they can call, once again, any street outreach worker and we'll try to see what they have available.
HEP does ask, and I know that because we have a contract with HEP at VA, and if they're full, I'll often ask Tina, do you have any other beds where we can put them for a few days to VA beds, and she'll say, they're my street outreach bed that has to go through street
And they'll-
outreach. So she
and they'll
keeps
call
that
us.
pretty- yeah.
So if I have extra or so many beds, they email me and say, hey Kathy, you have X number of beds open this week. I'll look down my list, start calling, and then we'll reach out to whoever. Like if I don't have a bed and maybe, or vice versa with Largo. Hey, you had one, I don't, you do, that kind of thing. So we work amongst each other, but we try, again, not to overwhelm the different areas either. Because it's.
And I think you're talking about a very static system. It's not a static system. If I have somebody that needs detox, before I can take them to a shelter so they have success, I'll take them to the Operation Park. I'll take them to Catcher's Mitt, so they have a few days to get their head together and we can finally get the clouds out and then get them to a housing program. So it's not very straight lines. There's ways of getting around the city.
So they may not be able to go to Pinellas Hope because maybe they've had 8 arrests for open container with nothing, any kind of treatment. So we may reach out and take them to PAR, then from PAR we'll take them to Catcher's Mitt, and now we've got verification that they're working on that issue that might make them more successful so that we're not burning up that bed with someone that's not gonna go out and get a job, not gonna be able to find housing, not gonna be successful. So we have to do that.
So give me 3 referrals for one individual.
One referral for one individual to make them successful, hopefully ending that, and that would be the last stop. Because the idea is to end homelessness. So that's what we do on the backside is, like Turning Point, we will take some down to Turning Point, but again, we try to utilize the resources that are up north with us, not to overwhelm because they may get down and say, hey, oh, I like it down here. The St. Pete doesn't need another one that likes it.
After we sit in the middle wherever there's a bed and they want to go and there's an opening, we send them.
Well,
We don't do that. So
The
we
other
try
aspect you
not.
have to look at too is you don't want that space in between programs. So if I get them clean detox and I'm gonna put them on a program, I'm going to pick them up and drive them. Because I'm gonna make sure there's nobody to visit on the way there. So I don't want relapse, I want relapse prevention, I wanna get them the right way. So when you do that, it's hard to go all the way down to Turning Point. It's much easier to do it at a park where you're in the vicinity and I can move them down the street to the next stop. So, I mean, there's not choosing one program over another, certainly not. It's just more logistics, time,
Right.
Yeah, Turning Point drop off for us is a 3-hour adventure.
Exactly, yeah.
It is for Clearwater, and then I'm not allowed to transport unless I have a PA available. They're not always available to me, so the officer, so I'm not gonna take an officer off beat for a 3-hour drive down to Barker or to St. Pete, just not gonna do that. I'm
And we
not
may
gonna
want
be
to
able
put
to
who
do
can
that.
transport, now that you just mentioned that.
Alright, so raise your hands if you cannot transport.
Well,
Raise your hand if you can transport, alone, independently.
If you can transport.
If you can't. Cannot transport independently.
Cannot.
I cannot.
If you can. You guys can arrange. Yes, so we have our PATH team that does all the transporting, but I cannot transport anybody myself.
Would you say that's a gap?
No.
Because they're always available when you
Yeah.
reach out?
And And she cannot transport by herself, but she can transport if I'm in a car with her.
Right.
So if
Right.
we absolutely didn't have an
There's no
officer
gap.
anywhere in the city that could transport, then we could.
Okay, so then what I'm hearing right now, there is absolutely no gap in transportation as long as there is like someone that accompanies either Kathy or April.
Oh,
But that doesn't appear to be like an issue, right? It's always being coordinated,
Yeah,
so it's not an
it's
issue.
flowing, we'll work it out amongst ourselves.
I mean, we can get a PA, I'll grab a garbage guy for all I care, I mean, they're all on payroll, it's like, hey, dude, you know, the big guys, if I want to go into an encampment area and I have an officer immediately available, trash guys there, those guys are big, they can walk in with me. We can look at it from an angle, okay, I need a guy to come in, now we're not pulling you guys off the beat. So, you know, but yeah, there's always somebody available, I just can't independently pick them up and take them from point A to point B. I mean,
I would say the biggest gap in this area, because I worked in a few areas in the United States, the biggest gap is say, having one central point to pick everybody up, to take up, people do like an intake at another time. I notice you guys have officers to do that for you. With us, we haven't really gotten into that yet, so I can pick somebody up and as long as I'm dispatched, but my boss is always, Arrow's always asked me, how do we get our numbers up of successful, intakes at say Pinellas? So if I get 16 people and I get 3 in, what's gonna, because people don't show up, it's that transport, it's the biggest barrier to anybody being on a house to get to programming. So I would say, having a van somewhere that's centrally located to move people over there would be the biggest gap that we have, is how we get mass groups of people to where we need to go for intakes.
well, we use my business card a lot too. So we have massive amounts of business cards that were printed out, so I can either text them or hand them off, and then we'll tell them, show that to the bus driver and tell them you're coming to meet me at the shelter. I need you to go to shelter. And most of the time, the bus drivers will let them ride for free to get to the shelter. So it's just being that assertive. Now, I need them to come to shelter, do me a solid. And then going to the bus stops, where you get to learn the bus drivers and all the staff that's there. Just we have the one in Clearwater, and I can just pull up and hang. I can sit there and do notes or make phone calls or whatever, so the van's always visible. Get out and talk to the bus drivers, they get to know you, they know what we're doing, they appreciate that. So you have to just learn to utilize the resources the best you can out here.
Okay. Susan, you asked about people that were here that wasn't represented on that sheet.
Yes.
So we have Casterville.
Casterville, hi.
Okay, guys, I'm loving what I see and I feel ignorant that I didn't know you were all doing this. And what the deal is, I was the founder of the Florida Dream Center, retired a couple of years ago and didn't really like it. So we've got 20 people we take out on the street, team. We haven't communicated with you about it. We do everything from the Palace sex offender camp to the railroad tracks, bushes. We're specializing right now in homeless widows. Nobody can stand any homeless stuff, but homeless widows is not okay according to the Bible. So we're not nice people, it's just the Bible said take care of them. We're actually putting them in our homes sometimes. And I know we need to report some of these things, and I'm learning now today, I'll start doing that better. We also do human trafficking survivors. We've had Homeland Security call us and say, can you hide men? State attorneys, we've hidden women, and I don't mean put them in a safe house, they have to be hidden, because they're gonna testify, it's bad, guys. So we've done things like that, and do a lot of things in Leland, and the area there, of course, and down 34th Street, both sides of the street. And St. Vincent de Paul, we spend we see about 100 people a week face to face, and refer them to places, but also help them with things. Taking them to court to turning point or whatever. None of us are licensed to transport. None of us have any paperwork. We just do stuff. And I see the value of letting you know about it. And, we've met a lot of law enforcement who've really been helpful, wonderful sheriff's department guys, Gibby, over in the Lumen area. So anyway, we do a lot of those kind of things you guys are talking about. And I think on the fun note, we try and get them all to come to church for broken people. So we have a special Friday night church service with witches and sex offenders and trafficking survivors. We actually have a couple of normal people, but they don't last too long. No, I'm just kidding. So anyway, we do a lot of this stuff. Would it be helpful if we provide our numbers to you guys? I mean, it sounds like, because we go into several areas every week, day, night. St. Vincent de Paul asked us to go do nights there because it's kind of an exciting place.
Are you mostly south of Wilmington?
Yes, south of Wilmington.
It is the Florida Dream Center?
I'm sorry.
It's the Florida Dream Center?
It's part of it.
No, we're
Is it part of
independent.
it? It's independent, okay, so
He was the.
I remember, yeah,
And this is the same group that that started doing the railroad tracks, it's the evolution of that group, right?
So you're under the radar, you're not an HMIS at all, unless somebody enters one of our providers.
You're nice at St. Vincent de Paul downtown St. Pete.
We serve there. And if there's no value in it, then I just won't report and I won't bother you guys anymore. But if there is something, and obviously, if we get human trafficking, we let the local jurisdiction know. If we get kids that are being hurt, we know where to send the right thing. But on a regular basis, we just don't communicate very much.
I think there's value in data, no matter where it comes from. Like I'm saddened that we're missing Pinellas Park, and part of that is because how we determine if someone is chronic is the amount of data that we can put together on them. So they have to have so much information in the system that shows that they have been touched in our homeless system, right? And there's anytime we're connecting with someone that wants to be in our system, that data is the only way we're gonna know who's out there.
Right, and then we build relationships with them out there. So if I have certain particular people that I deal with on a regular basis and then they go AWOL for a while, I may look and find out that they've been down in St. Pete, so okay, I know that they're okay. I don't have to try, to go out and start searching because we know that they have severe drug problems or alcohol problems or health problems. And now they're AWOL, we don't know where they are. Where are they? Because we know their numbers are way higher on the streets than what's reported. But where are they? So we start looking, and that helps us to determine, okay, they're down in St. Pete for a bit, they'll be back. Or they're up in Tarpon Springs for a bit, okay, they'll be back. And then you find out then if they do have along the stops, where are they plotting out and they're staying. Maybe they set up an encampment in Pinellas Park, or maybe they're up in Tarpon Springs hanging out or Dunedin, along the trails and stuff. Where are they stopping? That they're now not getting services. They're not getting that, that interaction with the outreach to try to assist with what they need. So I think HMIS is very helpful for us. It's not that we're spying, it's just that we're literally concerned about a lot of the people that are out there because we do get to know them.
And then you think about too, how many other groups, and I think what you're doing has tremendous value. I think that needs to be said. Especially because no one's asking you to do it, you're doing it because it's the right thing. I think that's so important. But how many other groups are doing that too that we don't know about, that you might know about, that you can connect us with? So I think having outreach teams connected with you, that way we can come alongside of you to do that work. We can capture the data, you can do the work you're doing, in the places you are with the people you know. But I think connecting to outreach as a whole would be helpful, not just for your group, but for all the other groups out there that are doing this work that we don't know about, and the clients that are out there don't know about us either. So we just need to bring those groups together. And I know you're about to hold a workshop with other churches too. I think this is a prime opportunity to bring churches into the CoC and vice versa. Bring the CoC to the church, all that. I think this is, glad you're here for that.
Terrific, thank you. One of the things that is a little sensitive is we have people who will not would not like us to give us their information. They're hiding, and obviously as a pastor, there's some things I can't disclose. You know, if they're going to commit a crime, I have to let you know. If they have committed crimes, I can't. But, so sometimes we just can't let people know yet.
Can I ask a question about, so at the task force meeting on Friday, which some of you were at, but so Pastor Bill and I are talking about this idea of engaging more of the faith community throughout the whole county. And so you all that are working with street outreach, I mean, how many of you have relationships with churches in your area or any religious leaders that you're already making a phone call to for, you know, this family needs, they say they go to St. Cecilia, their car's broken, I mean, do you have any relationships with religious leaders in your areas that you call out? Yeah? Do you think it's a normal, reasonable thing to ask, that could be, there wouldn't be a lot of pushback? If you've got a list of congregations in your jurisdiction that these guys want to partner and help with homeless diversion prevention or whatever, you'd feel comfortable making a phone call?
Oh, we do, but I mean, that's not something we're just gonna disclose out. I mean, if they find them, they find them. Churches are overwhelmed.
Yeah.
They're running out of money.
Right.
Nobody's going to church to pay tithing in, so where do churches get money?
Right.
So-
I know that's, yeah, I know.
Right, so nobody goes, but they're going to the churches to
Yeah.
get things.
I think that's
So,
such a
what
value,
churches you go to?
I think it's a really valuable resource, but you just wanna make sure it doesn't turn into a handout.
Yeah.
Right, I hand it
Because then
right.
it's just, one, you know, call all 20 program, call these 20 churches,
And
that's
it's
not how it
probably
works.
Right.
Yeah.
And we tell the churches that, okay, so what happened when you paid for that week in that hotel? What did that do to them? What, they brought back out?
Yeah.
So during that week, did they come to you and they say that I was still going to day labor? You know, you gave them that bed and they had a safe place to be, did they go sign up for day labor? How are you gonna hand that off? You know, because then you're just paying that.
I'm getting contacted by a lot of faith-based organizations, a lot of pastors who have somebody in the congregation or been around the church living in the back. So it kind of comes this way, because, you know, I'm not there to affiliate, you know, with belief systems. I'm here to navigate a system and to find the best fit for this individual. They'll find these entities in those environments, you know, they know they have these, they're, wow, that's intriguing, they want to maybe do promotion for that in that organization. My job is just to look at non-denominational
Right.
human beings.
Yeah.
Let's get these guys in the right direction, then they'll find whatever it is that their life needs. So we gotta remember that we're navigators, we're not really, it's hard to find the time to have all these relationships and
Yeah, and I, you know, I appreciate all that flow, but I agree with Kathy that it comes back to, and Helen, data. And so I like, you know, helping and all that, partnering, but data is really important to show how many touches and who's making an impact and what it all takes collectively. So, and that's where the HMIS stuff, it's like, who can be following that family that you might have, yeah.
I think faith-based groups are great, but we have good relationships with quite a few churches and stuff, but they usually call us after they've squandered a lot of money on people that are not doing anything.
Right.
I think if there was a way for them to know about this group and everything in advance, to call us for help first, you know.
They are starting to make those phone calls, you know, hey Kathy, hey Kathy.
Yeah.
So they're starting to get a little better as they're realizing that they're squandering a lot of money with no results.
Right.
So what should we do? How should we handle it?
And one of the things we were sketching out kind of was that for someone to partner with a faith-based organization, they have to have a case manager, a plan that they're working. You know, you know, pretty much, I mean, if we can take care of those first or something, I don't know, it's just a thought. We're still just sketching.
I've dealt with a pastor and I got through individually and also now they're getting in programs and they have the faith-based piece that's there. So it's there, it's just navigating them to the right direction.
Yeah.
So that data that we would have lost at the faith-based would stay, the pastor would stay, we have that data now, so you gotta get it right this way so you can get it down.
Thank you.
Okay, thank you, Pastor Bill. Were there any other street outreach providers that are not on this matrix, that we need to put on this matrix? Did I forgot about or any oversight.
I'm raising this as a question, is the street medicine team. I didn't know if we've talked about them before. So that is a team of 4, a provider, a nurse, a case manager, so to speak, and like an admin position. So the team of 4 that essentially do 8 to 5, Monday through Friday. And then they use, nighttime, weekend kind of events or activities. They do something similar to Metro where there's kind of like spots they go to with a schedule, but they also don't want that schedule to become anticipated, so someone's at this park just for the intention of connecting to that service or something like that. But they go throughout the entire county and really try to look at building relationships with providers and entities to understand where they might interact with someone. And then also do dispatch. They will respond if someone has a specific need. And they also will do like a contact tracing. So like a couple of months ago, there was a lot of TB, I think identified littering tracks, so they went out and did specifically that.
We go out with the street medicine team a lot, we connect with them in the community, and it's really helped us, especially as a newer entity out here, to build those relationships with people and see that we're here to help, we're not just here to like report them or whatever they may fear, so, street medicine team has been a really good partnership for us.
And then, TFL, yes. TFL and, Metro, the other Metro. Metro Inclusive, thank you. Metro Inclusive, they'll, tag team into that as well. Yeah. So very nice.
So was your question, Dominique, should they be added as a part of outreach?
I think they're kind of that specialty group, right?
I would say they're the specialty. Do they input into HMIS?
Currently, no. That is a Department of Health and HLA discussion, HMIS discussion.
Who's the point of contact?
That's a good question. We'll make the supervisor Ashley.
Yeah, who says that, raise it, Ashley.
Unfortunately, Maddie is leading the team with
Do you know why they don't input into HMIS?
It's a much bigger discussion between Department of Health and HMIS.
Figured it
There he is.
Welcome.
I don't know, they've expressed willingness and they have had them in the past, but they're just later, I don't know, later.
Okay, I asked more just to figure out how to, so they would be specialized. I know they do connect with whatever street outreach, whatever community they're in, they connect with them, exactly, so.
And then connect with all the street outreach teams.
I know when we did this with Built for Zero, we were really trying to figure out how we have street outreach in our community that doesn't look like street outreach, right? Not people that we know are street outreach, but are we capturing them as well? Like Pastor Bill, people that go out and do street outreach, but it's not on our books, not being documented anywhere, but how we utilize them as a community. That was a really big discussion with Built for Zero.
I mean, I know they have a schedule, where the MOU and all that's gonna be, the street medicine, I mean, I think their schedules are a little looser than,
And Maddie was really good at connecting, letting them know where, at least for St. Pete, where they were gonna be, or if they need anything and asking questions, so we connected really well with street outreach.
I know Maddie was trying to send out that schedule to like the providers, but again, it wasn't so the provider would tell the person like, oh, go to street medicine on Wednesday at Williams Park. It was more for teams to know, oh, we're gonna be there today.
Why is it that you don't wanna let unhoused know a regular schedule for free medicine?
Well, it's Department of Health that puts that together, and so again, that their thought was that if you're saying, I'm gonna be at this location at this time, that it would attract people to that area. And these aren't necessarily areas that they have agreements with, they're coming through, they're trying to see, who they can interact with that are currently in-house. So there's, like I said, Maddie is actually leaving the position this week, unfortunately, but they are working on having someone that is gonna be building all those relationships again. I'll do like a meet and greet all through the county with providers in case they don't have that foundation, but they're gonna hopefully build bigger, stronger relationships with that.
I'll add to that, there's also the mobile medical unit, and that does have a very specific schedule that is posted.
Oh, so I'm getting confused.
Yes,
I
so-
thought that's more the mobile.
Yeah, no, Mobile Med has a very strict schedule that
Okay,
is posted
good. Yeah.
publicly every month.
Yeah, got it.
And that's the large bloodmobile, the
Yeah.
smaller one size vehicle, the smaller one is a Sprinter van.
Oh, Sprinter.
And they do have like one chair in there, but it's a
Okay.
team, yeah.
Got it.
And the other thing is, I think they don't wanna be locked in, because if they're here for some, for a certain amount of,
Yeah.
right, and then people are expecting them somewhere else and they're not there, then it just sets people up. So I think
It's not their primary engagement.
right, their schedule is much more fluid.
Right,
than-
yes, and they don't want,
Two
if
different
they
things,
get
I
pulled
know.
somewhere else and someone comes up, right?
Right.
It's not an appointment-based service, like the MMU is appointment-based.
Well, Clearwater has a couple, as you know, that sit in their certain particular areas, that's all it is. Their only trust, that once we established it with seeing a doctor, that's it, that becomes pretty much their primary. And the idea was, oh, well, it's always the same people, oh, what do you think chronic is? It's, right, so I couldn't tell you the last time I seen mobile medical or the other out on the streets.
Yeah, they're there all the time.
They are, because I know they go to refuge.
Yeah, they're very, in Clearwater, they really only go to public, buildings that will allow them to be there because of municipality ordinances.
Oh.
Yeah.
We're gonna stay there.
Yeah.
Thank you. Were there any others that we want to add on to this rough draft matrix that needs to be finished and aesthetic? Any others?
Well done, everybody.
Yeah, that was good. That was
There was a
really
lot, that's information we've been trying to get for a long time, so thank you everybody for working that out, and thanks for all the questions. I think that the questions and the feedback were super, super helpful. I hope that they were helpful for y'all as well.
I might be repeating something. Helen had mentioned, when we were talking about specialties, you mentioned family resources. So are you can you follow up on them as homework?
Yeah.
Because they do some sort of outreach, and it's more in-reach at their location.
Yes.
And bullying, so.
And bullying.
Yes.
Bullying.
Yeah, so I'll reach out to Kelly Diesel with Family Resources to see if she can provide this information, or hopefully we'll be able to attend the next meeting.
There's another group.
And then Dama and Angela, I don't think that they were able to come today, but.
Well, hopefully,
Yes, who's on the list? Tens? Yeah. Do you want to have that list for their, I know, they're just mostly mental health. They should.
I would say that they wouldn't be.
Yeah.
So I think that in Candidate Outreach Standards, there's like another section that talks at the end.
Okay.
could it be possible before the next meeting, which we're thinking is in 2 weeks or so, that you reach out to BOLI and Family Resources so that if we're gonna start the meeting with a final review of every piece filled in, there with your draft matrix, so it's all done,
Yes.
and do a phone interview with them or something, that'd be good.
Yes.
Because as Helen said, going on to the standards, you gotta have a good area.
But I know they're asking them to go out, and so we can add it to our, I was just thinking.
Okay, so now we can dive into the standards. I would like to ask we can raise some hands, who had the ability to actually read, review, provide some commentary, notes on the street outreach written standards draft. Because I think for the purposes of time for today, I really want to hone in on the areas that were highlighted in yellow, and also hone in on those areas that you all may have already made some comments, feedback, and input to. So ultimately, all the areas in yellow, I purposefully highlighted them in yellow because I wanted those to be focus areas of us with the group to kind of talk about. But we can start with any comments that have been notated on your end independently prior to today's meeting. And I'm gonna share my screen. Victoria, do you want me, I'll share it.
Good.
Yeah, 'cause I ain't got no color.
It's not in yellow, it's in gray, sorry, this is printed in black and white, but they are highlighted in gray. Sorry, y'all, I did a FedEx order and it would have been twice as much to do yellow and highlights.
Now, do I need to unmute myself on Zoom? All I did was put share screen.
Alright, just so everybody knows, there are some addendums to this document that are not included. For instance, and I'm not gonna pass this out, I'm gonna ask somebody else to do that. There's one for each section of the table. There are some draft course standards that were included in the old version of, or the older version of the street outreach written standards. We've pulled them as an addendum because this was, when we started this process, a 130-page document. And I don't know if y'all have ever read written standards that were 130 pages. I now have. I don't really recommend it. So we thought that it was best to try and pull some of that so that we can have attachments for some of this stuff instead of it all being included in the same one. So, could you please do me a favor, can copies, one to each table, just so everybody has them? Thank you, ma'am.
We can also do the breakout rooms if you want, so we can do a rollout.
Okay,
So everyone, how many do we have? 2, 3,
we have 4 tables.
4 tables. Mix it up, right? So if you're all sitting with your people, maybe go to another group so you guys can all meet each other if you have not already met. The task for this is, let's have each group go through their input, their feedback, the areas that they really had that comments on, write it on a notepad, and then we'll come together in a large group and do a rollout of areas that we really want to specifically talk about with respect to today's meeting, that really need to be potentially changed, further discussed, etc.
Before we dive into that though, just a real quick overview of this document for anybody who hasn't had a chance to read it, because I know that sometimes we don't always have a chance to read things. So we start off with the purpose, there's some how to use this, some basic information, we define street outreach, we talk about the goals of the CoC, that kind of thing. Again, street outreach is written as SO throughout, it is defined in the very beginning of this document. If you think that is a problem, please let us know. We will update that because we want it to be clear for everybody, but also it does have a lot of words to this. So we've got things like, we do trauma-informed care, we are client-centric, we talk about trainings that are recommended, we talk about coordinated entry, and then we talk about street outreach practices, procedures, best practices, and whatnot from there. So there is a lot of stuff in this 40-some page document. Does anybody, before we go into any breakout groups or anything like that, have any questions about this document? You will have plenty of them afterwards, I'm sure, but I just wanted to make sure if you did, you had a chance to ask. All right,
I just have one question.
Yes, ma'am.
And mostly, it's, not everybody in here would have been a part of Vote for Zero, and I know we started this at that point, so was this merged with that information from Vote for Zero, because you all weren't here then?
That is a great question. Suzanne and Carly took a lot of information from Built for Zero.
So a lot of this isn't brand new. A lot of it is more information that were gaps from the last meeting that was had with Carly virtually.
Okay.
Yeah, so a lot of that was entered in still, right, and not removed per se, but then there was additional information that was just kind of like finessed and expanded upon in some areas that were those gap areas. Hopefully that answers your question.
Okay. So as we go into breakout groups, like Suzanne says, try and meet some new people, talk to some new people. Like, I'm gonna pick on you guys because you're right in front of me and your shirts are so bright. John, Paul, and Lucera, they work with each other all day. Split up. Y'all don't, I don't know. You don't know him, you've never met him? Well, then you should, he's really nice, I like him. But split up so that you're over here talking to Jennifer about what Metro does and Jennifer's talking to you about Alpha House. Sorry to call on you as well, Jennifer. But split up and go through this. I think that, do you want to do like...
Wait. So go through this?
We are really talking about the written standards.
Okay.
Each group will also have a copy of the core, what are they called again? Core services as well. And you can definitely look at and talk about those too. But primarily we want to start going through this document. And I would love to say this group go through page 1 through 10, this group go through page 11 through 20, but I don't actually think that's the best way to get all the best feedback on it. We're gonna have more than one meeting. So let's all start at the beginning, take a look, get your feedback together. If you need a big, big piece of paper.
Are we gonna do it all in the group, or we're breaking up?
I think we'll take 15 minutes for small groups, and then each group will announce kind of like what you all think that should change or be added or be reworded, etc. Who here already has comments that they worked on? Actually, if we can do a quick raise of hands.
All right, we have a few.
Like 4, did you say? 1, 2, 3? 3? Anyone else?
Can we say like maybe up through page 13-ish, where then it's got another heading of the coordinated entry system that seems to be, a bigger subsection, so maybe like 1 through 12 to focus on those for.
That makes sense. Yeah. I think that's a great idea.
5 through 12.
So we're
Great
not
idea.
overwhelmed.
All right. I think that is a great idea. So let's not dive into coordinated entry right now. We have about 45 minutes left here in this meeting. So let's go ahead and let's do up through where coordinated entry starts on page 13. And let's dive on in. Disperse.
So the 3 of us, you guys are table or you part of us?
One table.
Okay.
Yeah, I think one is our spot, and it's gonna be, so we think it's always regular and
I don't know what it
Please feel free to pull chairs on the inside. Oops. Don't worry, we have notes. I think that's pretty good, pretty useful. It is 11:58, by the way. If anybody does have to go at noon, I completely understand. If anybody would like to continue this conversation for a few more minutes though while we go around the group, HLA team, we're able to do that. At least I am. So, with that in mind, anything else from group 3? Group 4.
Alright, I'll give a little bit, y'all please add. So same thing, top of page 5, the X's, we're rolling to say like lean into DSP, the diagnosis and performance, they already have some standards and aligning those, and then flowing them back through street outreach teams for review. There is outreach represented in DSP as well. And then we also spent a bit of time talking about street outreach, and I'm gonna use like the big S, little s, kind of what is street outreach, and we kind of did this spreadsheet of street outreach, but still every team does it differently. And there's programs, and there's positions, and there's officers, and there's case managers and navigators. So we were kind of trying to piece that out a little bit because I personally got stuck in the weeds on that. So it's like, okay, is there a tiered version of street outreach, case management, street outreach program, street outreach officer? Another idea that was really good was the exclusionary memo at the beginning saying like this does not apply, this may not apply to positions XYZ or something like that. But how you would kind of parse that out, because this is what you all were saying, this isn't what every position does, but it is what some positions want to do. You know what I'm saying?
Yes.
And based off funding and based off priorities of their,
We can't box everything into the same,
yes.
because we're all doing the same thing on some layer, but we have a lot of other layers.
Yeah, and then the other feedback was kind of leaning into that was middle of page 7 and kind of throughout the document as well, is adding kind of the navigation language rather than some of the case management, because not all of the weekend, every entity does it a little differently. And then that was probably most of what I wrote.
Thank you.
Oh, and then we've asked Largo to give us a spreadsheet document that they have, just so they're gonna get that.
I'll get your permission to give that.
They're gonna ask.
Proprietary, sorry.
So we're gonna hopefully see where that goes, that does some tracking for them, that might be.
It's just a tracking system that I have, so I can see what's active, and I can post things off there, and I know it's HMIS, and if it has to be 30 days, I have to make contact with that individual, we haven't been able to get into half, because we haven't had an open bid for females. I have to get a hold of them, it keeps me honest, but it keeps everything we can probably off to order, I know how many people we serve, how many people we touch, and try to get the services we can call to. So, and then it's not repetitive, it's only one single, so if that client reopens, I can reopen them, and that, it's just a Excel template with a lot of drop boxes. If it came from an officer, I can put an officer where the referral came from, or it could be outreach, or it could be a phone call. So I know exactly, where I got that information, there's a sidebar at the end. It's a distinguished note, so I can remember who that person was, so it just works well.
And it's not like we're saying, like, everyone's gonna do what their form is, right? But it may, enhance your form, and then also just like CoC gives recommended forms, it could be, a foundation for yours or supplemental.
Or how nice to have a little resource, file for people that do street outreach about what's working for them.
His boss is big on data.
Yeah.
So in
Should be.
that spreadsheet, we could pull how many referrals came from phone calls, how many referrals came from officers, how many referrals came from them, how many, these people did we help this month, how many did we help since we incepted the program.
All sorts of ages, locations.
It's just great to have an internal document like that.
And then each month when you go.
Well, because I have prevention, I've got all these other things, and it's like, if someone asks me, I say, I've got a bunch of drop downs, I can tell you, this month we did this, or I did, or this is who we put away, like, I can manipulate it so I can figure out if anyone has a question.
Well, it really makes your end of the month HMIS data much easier, because we take what's in that data, in HMIS, we run the report, and what's on that template, but they're not running, I missed this one in HMIS, and I can make sure it's all.
So we make sure we get their case management notice in timely and all that good stuff.
Helps.
What I'm hearing is, Michelle, you also have a template. Could you share that with us as well?
I could, I'd have to get permission.
Yeah, of course. Understood, so tentatively templates coming from Largo.
Well, it's just a tracking more than anything.
Awesome,
It's a selfie,
thank you.
We take Venmo and Cash App, right?
Yeah. Certain LLC.
Gas.
Bus pass? Oh, we'll work for bus passes.
That was a
All right.
Thank you.
Thank you very much for your report. All right, number 5.
All right, so we were, some of the things we saw were on page 12. We were just going through, we didn't, we figured everybody was in the beginning, so we kind of went on other pages. So one of the things that we pointed out was, in paragraph 2, for 30 days post-transfer, outreach staff should continue to assist. We kind of talked about that we don't necessarily, each outreach don't do for 30 days once we get them into shelter or get them connected to services. As outreach specialists, we normally back out and let that case management do that. So taking some of that language out. Also right above that where it says case management, we are not case management, so maybe changing that language to more of either, community navigation or engagement specialist, in some of those ways. What else do we have? Oh, we also mentioned the next, not the case management paragraph, but the next one, the little one, participants should not be forced into case management. We thought possibly also adding that a street outreach specialist should also not be forced into case management. So maybe adding that in there as well. What else we had? We looked at the trainings and thought about adding mandatory reporting training as well. Is that it? Is that all we had, y'all? Am I missing anything? I think that's all I have.
Oh, you talked about, when we talk about, getting people like doc ready and
Oh, okay.
helping people with federal documents and whatnot. Outreach providers really aren't doing that, they're referring to organizations
Referring out,
to do that,
so saying more. So we, kind of in that case management language, just about our language of how we're putting, like we're obtaining things, maybe saying that we're referring them and, connecting them in more of those ways, because some street outreach don't do.
Right, one's outreach and one's case management.
Yes, right. So understanding.
Like the big thing for the city, our city anyway, was we are not a provider. We're a link to
Yeah, we're a
providers,
link
we don't want to be seen as a provider.
We are the provider.
Right, yeah.
We provide no direct services. I'm as close to a direct service as Clearwater has.
Right.
We pay out to the other entities to do that work. So my job is to refer them out to the agencies.
I mean, it's the right language because there is a difference between outreach and case management.
Yes.
And then you start doing your case managing.
There's an entire different skill set. So
Absolutely.
Correct.
So then that whole I'm sorry?
You said, what do we case manage would be done?
No, I was talking to you. I was talking to you. I was reading.
I'm sorry,
No, it's okay. I realized as soon as you said that, I realized like, I'm not looking at her, I'm looking over there. Yeah, so I was actually reading the case management thing and thinking that, wondering if that, it's hard, and I guess the idea is for all of us to get on the same page, because there are some documents that we do handhold people through getting, because you cannot do certain things, and so, Kathy, to your point, we kind of walk that fine line too. We're a funder, we're not a provider, but we are a provider, because we provide services and to some extent run our street outreach like a program. And we'll have fully funded staff and additional dollars attached. And so that then becomes a program because we're not telling somebody else to do it or asking someone else to do it. So, but I wonder for the sake of community-wide, if case management shouldn't be changed to like navigation and putting.
And that's what we said.
discussion.
I'm hearing that loud and clear from Todd over here. And from our officers that this is not case management, although quite frankly,
It can be.
in our world, like, it's
It
case
can,
management.
but that's what we said, to change that, so we have it crossed out to either some type of engagement specialist or community navigation, something other than understanding that case management is.
You know, the simplest form of that is, you can't get documents without an address. I need to get them in a program so they have an
To
address.
actually get them.
You know what I mean? So if they're on the street still, and I still have them on the street, they have a hard time having an address to get their new license or birth certificates or anything.
Yeah, but we work with
But
that,
see,
like, we
then I was
provide
gonna
the
say,
letter
we
and we
got
take them,
Daystar,
we take them to Daystar, so that
Every
becomes a
area.
program, right? So we,
Right, you take them there.
we take them there, or we provide the letter for them to give their ID, and they actually go, we might transport them to the driver's license place and sit with them if we need to, for them to get that, if we need that ID for them.
Right.
So it's different, but I respect the fact that case management isn't the correct term
This
Yes.
document.
For
for
this
this
document.
document, for our community.
Yes. Y'all's different, ain't I'm not going out there to do any of that. You get a letter, you go, you're at your bus,
Maybe there's.
next to us over there, no, I'm not holding the antique. Yeah.
Everybody
But
does
that's why it's good to have that at the bottom thing,
Right.
The little asterisk box,
Yeah.
in some cases.
In some cases,
Well, I think.
different cities, we do.
different, well, different people.
I think part of it goes, and that's what we were saying, when I was saying like, I got stuck in this idea of like tiers, because there is an officer, there's different municipalities too, but Metro's gonna do it differently. A half funded through Central Florida, that is supposed to be case management, that's supposed to be outreach case management. So it's like different parts apply to different, there's like a different layer, and so how do you show that layer in
Right.
the policy?
And I just that you said that, not even PAT funded, because city funded, we're expecting a case manager through DFL, because that is what was presented, so it would be case management.
Yeah.
Right, and so, so the tier does make sense for some.
So perhaps what this should say is, community navigation, / case management, noting that all organizations that provide street outreach participate in community navigation and engagement activities, and some organizations that participate in street outreach provide case management. But some, but not all.
I mean, we can even put under there, community navigation, and then put the tiers and explain, some navigation and case management attached. And then just kind of go 1, 2, 3, what is that? What is, and elaborate a little bit more on the navigation part on this paragraph.
Right.
And I'll say on the case management part as well, because even if it's case management, understanding that it's very light.
Light touch case management.
Right.
Does everybody agree? Should we really specifically, everywhere we talk about case management, say light touch case management?
Yes, because HOA does the same thing, but it's not full on
Yeah.
case management.
No, but if you do that, and I'm not saying one way or another, but if you do that, then in instances where there's a funder and I'm holding an agency accountable to these standards, it's not light touch that I'm expecting. I'm expecting case management because that's what they wrote their application for and that's what we're paying for.
Was that in their title?
Okay, so then that's a different tier. Then that's a different
So that's
tier,
a whole
then
different tier.
there's a light touch case management and there's case management.
Yeah.
Okay?
Because that's their agreement.
And I think that to not continue to update these, if we just have it there, then we can all recognize what space we're in. Okay.
Because it really comes down to capacity. If there's only one of me, I can't case manage 50 people.
No.
But I've been to other cities where they had 12 outreach workers. They were more case managing in their
Yeah.
regions because they had capacity to do it.
It's not here.
You see it.
It's right behind.
Right, I walk into a meal time, I got pieces of that.
You can't case manage.
Right.
So, almost 5 hours, 67.
I'm starting to.
It wasn't 74, by the way.
It started at 70 this morning and it has slowly gone to 76 as I've been watching.
It wasn't 74 when I got here.
Best shot.
Right, I was like, I was so happy to get
I don't know, other people got further.
All right, so group 6, is there anything else to add from back here?
I don't think we have much to add, but we just had some observations regarding the prioritization list meetings. I know that there's been a big discussion about maybe making sure that on page 14, I'm sorry. Oh, we went too far, okay. Well, over
Look at you
here.
get ahead.
But did we do the program staffing?
Nobody brought that up.
So just as a thought, cause I guess maybe we can start that next time.
You did, you know what, you're right, April mentioned training, but go ahead.
No, that's what I was going to say. A lot in our community, we say things are recommended, and I think the reason why we're doing things so differently is because it's recommended. But if it were required that everyone attend trauma-informed care, certain things, right? Even the way that we put information into HMIS is different, and so we recognize that a service doesn't lead someone to chronicity. However, street outreach is not put in an interim, those everybody across the area is not. So something should be required. It just has to be, or else we're never gonna get on the same page.
Okay. So our big concern, and Daisy, please feel free to cut me off at any point in time. Our big concern with calling things required is that we really don't have a ton of way to hold people to that. However, once this document is finished, we are going to ask the relevant parties, the street outreach providers and the folks from your agency who are responsible for signing things to sign on to this finalized document. So that is maybe where we say, listen, your team signed on to this, you've said that you will do this, so it is required. So if everybody agrees to that, I think that is
Well, I mean, if we agree to it here, then it's required. I
Well,
think that's a fair trade.
you might not have a way to hold people accountable in that way. However, this could be written into our agreements easily as funders, and it's just a line that says that you'll comply with
Follow
this.
the CoC standard.
And so as long as we have that in our agreements, then they're held to that, then agencies are held to that.
Okay. I think that that's good. So
And those that have it in our community, like St. Pete, then you're held to it.
okay. So is there something in that section specifically that you sorry, I just want to make sure that
the trauma, because, and I picked trauma-informed care specifically because we talk about that so much, but what does that look like for PD? That's completely different, right? And have we all had the same training? It needs to be required, and it needs to be, since that's the lens we're coming from, how do we require that, and how do we make sure everybody hears and gets the same kind of training? There's some HMIS trainings that are,
those are required.
well, they might be required, but the way that we are putting things in is not required. It is kind of like, if you'd like to do this way. But I think it would help all of us if everything were put in the same way.
Okay.
And then maybe it wouldn't be so cumbersome on those that are inputting into HMIS, because then you know exactly what you have to put in order to make sure that we're getting the data that we need.
Okay. That makes sense.
The data in HMIS is what gives us our funding,
Right.
our big funding, so.
Yes, ma'am.
Since we're on that, I know we're at the end, just a suggestion of keep trying to meet in person for training, getting back to in person for our trainings and not every single training being on Zoom, especially for some of the trauma-informed care needs to be in person, mental health first aid, to me should be in person. Some of these are just too valuable to not be in person.
On that note, there is trauma-informed care training series going on right now that is virtual, but it is a 5-part training series taking place every other week. It's posted on the HLA's website if you haven't seen it. And I'm happy to say Megan right now is working on scheduling, there she is, I'm pointing back here, Megan's not back there. Megan right now is working on scheduling an in-person fair housing training as well. So we are working on that. Thank you, DEI committee, for that request. Awesome. And by the way, if you look at the training lists and you see things you think should be changed, added, edited, let us know. Any other notes through page 13 up to coordinated entry on this document before we wrap up for the day? No? All right.
We can email you if we have
Yes.
comments.
Yes, absolutely. This is not speak now or forever hold your peace. Nothing with me ever is, unless there is a code of silence that's started, but there is not. So please continue to work on these. Send us your thoughts. If you want, you can edit your physical draft and bring it to the next meeting. If you have notes that you want us to take with us today, please give us some, or please email us. If you need our email addresses, please let us know. But you all got there, so I assume you have at the very least mine. Other than that, Susan?
Yeah, I just would like to reiterate, before our next meeting, if you all can go through again, just really provide those comments and feedback. Even if it's before our next meeting, and if you just email it to me, that would be absolutely amazing. Because then I have some time to put it into this working document, so everyone can see, and it can be digestible, right, like visually. And everyone's comments and notes can be indicated onto this like working document draft that I saved as a copy for the purposes of this work group. And the next meeting, so I believe we had talked about the next meeting.
September 5th.
September 5th.
Yep, tentatively for September 5th. We just gotta get back to our desk and make sure we can make it happen.
Kind of like this.
But we're gonna
Yeah,
try to do the morning.
And we'll also shoot for more mid-county. So we'll get that.
Right, I know,
Okay, so September 5th in the morning actually is not a good date, but we will get back to everybody and we'll make sure that we get that on the calendar.
Can anybody do September 5th in the afternoon?
I don't do afternoon.
We'll send something out. We'll make sure that we get that next one scheduled. And then this one that we have on September 5th is a one-off meeting for the NOFO, so that won't get in the way of future meetings. So, all right. Thank you, everybody. Thank you so much for your hard work. Really, really appreciate it.
Yeah, have a good day.